Did you know that every year more than 17 million people worldwide die from cardiovascular diseases? The most shocking part is that many of these deaths could be prevented if people knew basic survival techniques to use during the first critical minutes of a cardiac event. Today, you're going to learn something that could change your life, or the life of someone you love. I'm going to teach you 3 emergency techniques, backed by medical science, that can help you gain precious, life-saving minutes when the heart is in danger and no immediate medical help is available. Imagine this situation for a moment. You're at home, quietly watching TV or preparing dinner, when suddenly you feel intense pressure in your chest, someone were squeezing you tightly. Breathing becomes difficult. Cold sweat breaks out, and you feel dizzy, like something very serious is happening. You're alone. No one else is at home. The phone is out of reach. In those critical moments, every second counts. What you do in the next few minutes could determine whether you survive or not. This is the reality thousands of people face every single day. Attack or sudden cardiac event doesn't wait for the right moment. It often strikes without warning, and often when we're alone. According to the World Health Organization, about 80% of premature deaths from heart disease and stroke could be prevented. The key lies in knowledge and immediate action. Before we continue, it's important to clarify, this video is for educational purposes only. It does not replace professional medical advice. If you want to go deeper, consult qualified doctors or specialists. What you're about to learn are first aid techniques that can buy you valuable time. They are not a substitute for professional treatment. Technique ID 1. Controlled cough CPR. This method is based on a fundamental medical principle used by emergency professionals worldwide. It's known as cough resuscitation or controlled vigorous coughing. Here's how it works. When the heart slips into a dangerous arrhythmia or begins to stop, a strong, controlled cough can create pressure inside the chest that helps stimulate the heart, similar to the effect of an external defibrillator. To apply it, take the deepest breath you can. Fill at least 80% of your lungs. Close your mouth tightly. Use your diaphragm and abdominal muscles to produce a strong, dry, powerful cough. It should be loud and forceful, not soft or weak. Repeat every 2 seconds until symptoms ease or help arrives. The American Heart Association has documented cases where this technique increased survival chances by up to 30% during the first moments of a cardiac event. It's especially effective when you remain conscious and can control your breathing. If you feel chest pain, shortness of breath, dizziness, numbness in the left arm, or pressure in the jaw, these are early signs of a heart problem. Controlled coughing could give you the extra minutes you need to call for help. But if the pain is overwhelming or you feel you're about to lose consciousness, you need a stronger technique. Technique Weight 2A. The precordial thump. This may sound extreme, but it's scientifically valid. Known as the precordial thump, this technique mimics the effect of a pacemaker or defibrillator by using mechanical force from your fist to deliver an electrical impulse to the heart. Here's how to do it. A horizontal line connecting your nipples. The impact point is the exact center of this line, on the sternum, breastbone. Make a fist with your dominant hand. Strike with the bottom of your fist, the pinky-sided, not the knuckles. Bring your fist down like a hammer, with firm but controlled force. Deliver 1 strike per second, 6 times max. Studies in German medical centers have shown that about 20% of patients in cardiac arrest regained consciousness when this technique was applied within the first 3 minutes. Warning: this must be done precisely, only when there are clear signs of cardiac arrest and no immediate access to medical equipment. Striking too hard or in the wrong place can cause injury. Technique Phase 3. Acupressure point stimulation. This one comes from traditional Chinese medicine, but has also been validated by modern medical research. It involves stimulating the Hegu point, also known as Li4, located on the back of the hand between the thumb and index finger. For thousands of years, this point has been used to help with heart and respiratory issues. Modern research shows it can stabilize heart rhythm, improve oxygen delivery to the brain, and reduce blood pressure during acute stress. To apply it, locate the hollow between the bones of your thumb and index finger. Use the thumb of your opposite hand to press firmly on this spot. Hold for 5 seconds, release for 2 seconds, and repeat for about 1 minute. Alternate between both hands. This technique also helps keep you calm and focused during a crisis, an essential factor for survival. Combine these techniques if you can breathe and stay conscious. Start with controlled coughing. Symptoms intensify and you feel you may faint. Apply the precordial thump immediately. Throughout both, panic rises. Use acupressure stimulation to stabilize yourself. Remember, these methods are not replacements for professional help. Call emergency services immediately. 911 in the US, 112 in Spain, 123 in Colombia, etc. Precautions you must know if you feel faint, flat before trying anything. This prevents injury from collapsing. Don't overexert yourself while coughing. Be firm, but within your strength. The precordial thump must be precise. Practice locating the exact spot when calm so you know it in an emergency. Even if symptoms ease, seek medical attention immediately. Can continue silently even if you feel better. Beyond emergency techniques, prevention first. The best treatment is always prevention. At least 30 minutes daily. Avoid tobacco completely. Limit alcohol. Manage stress. Eat a heart-healthy diet rich in fruits, vegetables, and healthy fats. Learn the early signs of a heart attack: breathlessness, sudden dizziness, cold sweats, jaw or arm pain, or unexplained discomfort. If you have high blood pressure, diabetes, obesity, or family history of heart disease, take extra care and see your doctor regularly. Final thoughts: these 3 techniques, controlled coughing, the precordial thump, and acupressure stimulation, can be applied in less than 10 seconds and may give you the vital time you need to survive until help arrives. But remember, they are emergency measures only. Use them to buy time, then get professional care. Please practice them in advance so you won't panic and forget in a real emergency. If you found this useful, share it with your family and friends, because one day, this knowledge could save a life. Stay healthy, stay prepared, and I'll see you in the next video.